the fall, how it ends. It's the fall, how it ends. Or it's the fall, how we rise again. Ooh.
Now we're going to talk about the role of PT in PCOS. So usually when we talk about PCOS and we are like, oh, what does a physiotherapist do in PCOS? Our basic thought is exercise prescription our only role in PCOS? Is that so? Well, fortunately, the answer is no, because as I mentioned, as we've seen in the previous slide, that lifestyle modification is a cornerstone in the treatment and management of PCOS. And many a times it is also prescribed as the first line of treatment in PCOS. And we as physiotherapists, we deal with lifestyle disorders day in and day out. Also, we are one of those privileged healthcare professionals who get to spend maximum amount of time with our patient or our client. So our role involves prevention of this lifestyle disorder by education, by maintaining a healthy lifestyle, manage if a person comes with PCOS, to manage that through lifestyle modification, which we're going to talk a little bit more about it in the next slide. And third is referrals. So, because there are so many symptoms, it's very important that PCOS is a team care approach. So as physiotherapists, you identify the symptoms and identify the need to refer to another healthcare professional, be it a gynecologist, be it a nutritionist. It's a team team approach to actually treat and manage PCOS. So referrals also form an extremely important part as our role in PCOS. Now, we're going to talk about lifestyle changes or lifestyle modification. And I once heard this from someone. Metaphorically, they explained a healthy lifestyle as a car or a beautiful Jeep. And the 4 tires of that car are responsible for the healthy lifestyle. That is your diet, your exercise, your sleep, and your behavioral changes. Now, these 4 tires are extremely important to have a healthy lifestyle, irrespective of any condition or not. Okay, just to be healthy, you need to have these 4 tires intact. Even if one of this tire is flat or is not working well, or it's disrupted, your lifestyle is not maintained. So you develop lifestyle disorders. So when we talk about we talk about lifestyle modification, we are not only talking about, you're supposed to exercise, you're supposed to maintain a healthy diet, but if you are not bringing about behavioral changes or not sleeping well enough, none of it is going to work. So all four of them, you have to focus on all four of them to see results in PCOS. So remember, if you're just doing one of them or two of them, not sufficient. You have to focus on all of them together: your diet, your exercise, your sleep, and a few behavioral changes which will help you deal with the symptoms and also with the condition. Now we're going to talk a little bit more about each one of them, how you're going to educate, how for educating, obviously we need to understand the importance of each of them. So first we're going to talk about sleep. Now, sleep is one of the most understated things. Nobody pays attention on sleep. We have to work, you have to do everything, but nobody cares about how much you sleep and how important is sleep for your hormonal and reproductive function. So talking of sleep, there's something known as your circadian rhythm. It's simplistically, if we speak of it, it's your body's own biological clock. Okay, so when the sun rises, when the sun sets, there are a lot of hormonal fluctuations that happen in your body every day. And as a part of the circadian rhythm, there is a substance called melatonin, which is released towards after sunset in our body, which is responsible for your sleep. So the melatonin is responsible for your sleep-wake cycle. Okay, when the melatonin production increases, that's the time when you feel a little sleepy and you feel a little groggy and you need to go off to sleep. And it's also like, say, around 10 o'clock in the evening or night, there's a surge in the melatonin production, which lasts up to the entire midnight, and then slowly it keeps on decreasing, and that's how you wake up. Now, apart from that, the melatonin is not only responsible for the sleep-wake cycle, but it also has a lot of reproductive functions. That means it helps in stimulating the formation of follicle-stimulating hormone, which is extremely important, as we've seen previously. It also helps in oocyte formation, ovulation. So overall, melatonin is an extremely important substance for reproductive function. Now, what happens is when you do not sleep well enough, the melatonin production decreases. Also, when you're exposed to various environmental factors, the melatonin production decreases. Now, when this melatonin production decreases, obviously you're not going to sleep well. But at the same time, your reproductive function gets hampered. And that's where all the change happens. Okay. Apart from that, poor quality sleep is responsible for disturbance in your hypothalamus pituitary adrenal axis. Now, this HPA axis is extremely important because a normal functioning HPA axis helps in maintaining the androgen levels in your body. However, if there is a disruption of the HPA axis, there'll be the androgen levels in your body will keep on increasing, which again is responsible for lifestyle disorders like PCOS. So what are the few strategies that we can incorporate or we can suggest to women who come with PCOS? First, we all know it, avoid caffeine, especially in the evening hours, because that reduces your quality and even the amount you sleep. Second is no screen time, at least an hour before bed. Now, when we say of screen time, I mean no phones, no laptops, no iPads, no TVs. In fact, I would even say don't sit in a brightly lit room, because that will affect your melatonin production and you're not going to sleep well. Third is exercise regularly. So studies have proven that regular exercise is responsible for a deeper sleep. Okay, the REM cycle during sleep is better, and you have a better quality of sleep. Also, sleep time regularity. That means that if you sleep every night at 10 o'clock, maintain that cycle that every night you're supposed to sleep at 10 o'clock. Whatever time you sleep, preferably earlier, try to sleep at the same time so that it forms a routine, your body forms a routine and you're adapted to that. And that in general will be helpful for dealing with your symptoms of PCOS. Now, talking of behavioral changes and diet. Now, behavioral changes refer to, day-to-day changes, day-to-day lifestyle choices that we make, which are responsible for how our body functions. So we're talking about in PCOS, it's important to explain to your clients and your patients to have SMART goals. So when we talk about SMART goals, we talk about specific goals. It should be specific. If their condition is more pertaining to insulin resistance, that should be their specific goal. It should be measurable. There should be outcome measures to measure that specific goal. It should be attainable and realistic. That means many times people will come that, oh, I've put on a lot of weight, I'm obese, I need to lose 10 kgs in 1 month. I don't know if it is actually attainable or if it is realistic. Could be. I don't know how healthy it is. So yeah, it should be attainable and realistic. And last but not the least, it should be time bound. You cannot take forever to deal with the symptoms. It's a slow process, but you have to have a time frame for it. Apart from that, there's something which is very important in PCOS, which is self-monitoring. Now, when we talk about self-monitoring, we have to empower or enable the ladies to monitor themselves in terms of their symptoms, in terms of their condition. For example, self-monitoring their blood sugar levels. It could be self-monitoring their period cycle. So nowadays, there are various apps available on your smartphones, like your period tracker, which helps in monitoring not only your menstrual cycles, but also the various symptoms like acne, mood swings, bloating. So I think we have this technology, so why not use it? Also self-monitoring in terms of body composition and other such things, and even our emotional factors like mood swings, how you feel, irritability. Documenting that, journaling that could be one such way of self-monitoring. Then another thing is increase in NEAT, which is nothing but your non-exercise activity thermogenesis. It refers to the calories that are burnt when you're in activities other than exercise. So it includes, like, when you take the staircase instead of the lift, or when you're walking, or when you're gardening, when you're doing something else which is not a part of your exercise routine, but those small activities help in burning those calories. So increasing your NEAT is really important, and that's how, like, the ways that you can do it is by, as I mentioned earlier, use the staircase instead of an elevator. Try not to be a couch potato, stand up, walk ahead, go get things, get your own groceries instead of going on the bike. So those are little things how you can improve your NEAT. Last, coming to dietary modifications, it's very important to increase the dietary protein, fiber, fruits, and vegetables in a PCOS specific diet. Also, like, there have been various research and studies which have shown that consumption of highly processed and refined food causes a lot of hormonal fluctuations. So decrease the consumption of anything that comes in a packet. Anything that comes in a packet, you open it and you eat it, it has a lot of sugar, salts, oil. You're not even aware of it. So even if they write no added sugar, you have to be very, very careful. Also, replacing food that has a higher glycemic index with something which has a more moderate or lower glycemic index would be favorable, because it would not lead to your sugar spikes. Yeah, but then again, as we say this, it's best to refer to the best therapist or the best healthcare professional, which is a nutritionist. So always refer to a nutritionist for dietary modifications in PCOS. Okay, now moving on to something which will interest everyone, which is exercise in PCOS. And before we talk about the exercise prescription in PCOS, it's so important to understand why is exercise so important in PCOS. I mean, we are exercising, but we need to know why we're exercising and how it's going to help you. So Now, we're first going to talk about effect of exercise on insulin resistance. So, regular routine exercise training helps in increasing the glucose uptake and utilization in the body. It also helps in increasing the insulin sensitivity. So, if the insulin sensitivity increases, the blood sugar spikes wouldn't be as much. Also, it decreases the glucose intolerance that is there in the body. Apart from that, exercise also has an effect on the reproductive hormones. That is, there have been studies which prove that exercises like an exercise training routine helps in decreasing the pulse amplitude of luteinizing hormone, which in turn helps in reducing androgen levels in our body. Also, it increases the SHBG level, which is the sex hormone binding globulin, which is responsible for PCOS as well. Now, coming to the exercise recommendations for PCOS, how much you should exercise, what kind of exercise, like there are so many things on the internet and books, but how much, what is the prescription? So usually it is advised to do a combination of aerobic and resistance exercise in PCOS. Now we're going to talk about the FIT principle for PCOS. So the frequency, they've suggested 5 days per week or more. Intensity. Now there are two options that are suggested or recommended for women with PCOS. The first one is if you're opting for HIIT, that is high intensity interval training, that is around 70 to 80% of VO2 peak with 6 episodes in one session. So if a session lasts for at least say 60 minutes, there should be 6 small mini parts of it with 15 minutes of active pause, that is active break, where you're doing something but at a lower intensity of 55 to 60% of VO2 peak between these bouts. So the RP is somewhat between 14 to 17 when you're doing HIIT. Also, another alternative is moderate intensity. So something about 60 to 70% of your HR max, or if you're talking in terms of RPE, so 12 to 13 RPE. The timing is, if you're doing HIIT, you can start with as little as 20 and go up to 60 minutes. But, HIIT is usually prescribed for a shorter duration of time. And moderate intensity can start from 30 to 60 minutes. And the type of exercise could include anything which involves large muscle groups like your cycling, treadmill, running, jogging, all of that. Now, progression, how do you progress? Like you cannot stagnate your exercise. So the progression happens at the rate of 10% of your HR max every 2 weeks. And after 4 weeks, you have to reassess by doing a submaximal or maximal exercise testing. Now, coming to your resistance exercise, it has to be done as much as 2 to 3 days per week. Initially, you can start off with 60 to 70% of 1 RM, and the number of sets and repetitions include 2 to 3 sets of 8 to 12 repetitions in one set, and give frequent rest intervals between 2 sets. So there'll be like a 1 minute rest interval between 2 sets. Apart from that, what all can be used, like the mode of exercise could include anything. You can be as creative as you can. You can use body weight resistance, you can use dumbbells, barbells, TheraBands, TheraTubes, any of it. And usually try to incorporate all the major muscle groups, the large muscle groups, your triceps, your biceps, your hamstrings, all of them. Progression of your resistance exercise can happen in terms of either your repetitions, so you increase your repetitions, or you can keep the repetitions same and increase the sets. So based on the RP, you can, progress the resistance exercise. Now, coming to the recent advances in PCOS. So as we see in the previous slide, we are talking about high intensity interval training or moderate intensity. Now, these are the recommendations that are given for exercise prescription for PCOS. But also there have been various studies which speak about the feasibility if HIIT is better or moderate intensity steady state exercise is better. So so one such thing is a recent advance of what is actually better for PCOS. Either it is the high intensity interval training or the moderate intensity exercise. So there was this very interesting systematic review and meta-analysis in 2021, which suggested that moderate intensity steady state exercise proved to be superior, if equal, if not even superior, than HIIT in optimal management of PCOS. It also showed that there was an improvement in anthropometric profiles and VO2 max levels. Moreover, HIIT was associated with increase in cortisol levels, which is again the stress hormone. Like when you are doing HIIT, we are not only talking about stress, which is emotional, but you're putting your body under a physical stress, which may affect the metabolic and reproductive functions and cause hormonal fluctuations. So it has been suggested that moderate intensity exercise is a preferable choice as compared to HIIT. Now coming to complementary therapy, which is also where towards the end of the session, and we cannot not talk about something which we Indians love doing, which is yoga. So complementary therapy, like yoga, has also proven to be extremely effective in PCOS. There have been various systematic reviews, meta-analysis, RCTs, which suggest that PCOS has helped in regularizing the menstrual cycles and reducing clinical hyperandrogenism. Also, there is a decrease in the HbA1c levels post-yoga. There's improvement in body composition, waist-hip ratio. Also, since yoga is a mind, body, and spirit therapy, it incorporates all of them. It has helped in decreasing anxiety and depression, which is very common in women with PCOS. And one of the factors that I found really important is all these studies, or most of them, were done for a duration of minimum 2 months. So you had to practice yoga for minimum 2 to 3 months to see any change. Something like a hormonal change or a physiological change will not happen overnight, will not happen over a week, but it takes time. So you have to be persistent, you have to be adherent to see such changes in your body. And now we're done with the slides on PCOS. Thank you. I would like to hand it over to Dr. Aarti ma'am to take it forward.
Hello. Can you hear me, Semira? Am I audible?
Yes, ma'am.
Okay. We have a couple of questions. I must say that it was a very lucid presentation with all information, quite a lot of information in a very precise time, but very well done. Can I take the questions, Semira?
Yes, ma'am, please.
Okay. Okay. The first question is, what are the strategies for prevention for primary prevention of PCOS in adolescent girls? And will these strategies help them avoid getting the symptoms of PCOS in their life? Should I take it or you'll answer, Semira?
Yes, ma'am. I'll like to speak on this. So, talking about the primary prevention of PCOS, it's the same thing where we talk about even as early as in adolescent girls. It's very important to maintain a healthy lifestyle by having a healthy diet, by making sure that they are at least active. Nowadays, because of the use of technology, a lot of the adolescent girls and kids in general, they are they don't like to go out and play. They don't are not exercising or not doing any form of physical activity, which also puts them into a risk of developing PCOS. If not now, then definitely in the long run. So I think your exercise, maintaining a healthy diet, also having proper sleep cycles. We're used to being on social media till late at night, even adolescent girls. So I think all the 4 tires of the car or the truck is extremely important in preventing PCOS even in adolescent girls. And the other question, if I'm not mistaken, is will the strategies help them avoid getting the symptoms of PCOS? all through their life? Well, yeah, maybe to an extent, but if there is a family history, of course, they may be susceptible to it, but quite a bit. Probably the symptoms may not be as bad, or the entire condition may not be as bad as it would have been if they do not have a proper healthy lifestyle. I hope I've answered that.
Yes, yes, correct, correct. I think it is like there is no proven evidence that there are ways to prevent PCOS, because it is a condition which we say that cannot be cured completely, nor can be prevented, but can be taken care of by reducing the symptoms, or can be prevented to a certain extent where it is not bothering the estrogen levels or the hormonal levels in the body. So as she said that, small broken wheels, exercise. Am I audible?
Yes, ma'am, now you are.
Yeah. Okay, can I take this next question? I think I reconnected it and I couldn't see the other questions, but I could see a question where a person asked that after pregnancy, is PCOS reversible? Can I add on to this?
Yes, ma'am, surely.
Yeah, as we say that once pregnancy occurs and the female delivers, there is a lot of reproductive changes that are occurring. And as I again mentioned that PCOS is a chronic condition, but after pregnancy, there can be cessation of symptoms. So there is a lot of regularization in the hormones, which will help as you said, the insulin sensitivity, decrease in androgen levels, all those are going to be taken care of by the reproductive system after pregnancy. But it's not a myth. We have seen patients where post-pregnancy or post-delivery PCOS symptoms are reduced. And there is a natural conception that has occurred in the next pregnancy. Would you like to add on, Semira?
Yes, ma'am. I absolutely agree with what Dr. Aarti ma'am said, that you cannot say that it's completely reversible after conception, but because there are so many physiological and hormonal changes that happen in the body post delivery or post pregnancy, that many of the symptoms may be may reduce.
Yes.
Ma'am, should I read this next question?
Yeah, I had one more question I had read through. Can you brief about lean PCOS? Someone said that.
Yes. Yes.
I
Shall
think
I answer
the
that?
slides. Yes, yes, you can go ahead.
Okay, so when we talk of lean PCOS, now there are two very distinctive kind of PCOS. One in which there is increase in the body composition where you put on weight and there's obesity, and the other one, which is also very frequently seen, is lean PCOS, where a person may not gain weight, maybe even lose weight for that matter, but experience other symptoms of PCOS where there is a rather focus on menstrual irregularity. There may be insulin resistance, which would be the mainstay of the symptom, but not much about in terms of weight gain in PCOS. And the clinical, even in terms of management, the lifestyle modifications would be similar. Probably the dietary changes and exercise recommendations might change a little bit in terms of, for the weight loss. But more or less, it would be like, you have to incorporate a healthy lifestyle, diet, and exercise for the same. Ma'am, would you like to add something to that?
Semira, I'll just make her the co-host. By mistake, she got exited.
Yes, ma'am.
Semira, I guess we can take the next question. Looks like there's some network issue. Ma'am is unable to join immediately. So meanwhile, we'll move on to the next question. And then as in when ma'am joins, she'll join us.
Okay. Now, the next question is what I see is what type of yoga or yoga postures can be used in a protocol. Now, there have been various studies, and as I mentioned earlier, there have been systematic reviews and meta-analysis. So there is not one specific asana which is favorable for PCOD, but an entire yoga routine that most of the studies that I've seen have used Iyengar yoga for PCOS, and they've used routines from Iyengar yoga to deal with PCOS. Apart from that, there is another question on how to form fit for adolescent girls. Okay, so in terms of the fit principle for adolescent girls, there is an article by, if I'm not mistaken, Teed and Associates talking about the recommendations for exercise recommendations for PCOS. And over there, they have mentioned that the volume of the exercise would be almost similar for adolescent girls. However, including a lot of exercises which are play-based exercises would be more favorable in adolescent girls. So the frequency could be the same. Probably the type of exercise would change in terms of including a more play-based exercise or something that they find important, because adherence is a very important factor for PCOS. Like many of the women start with exercise, or many of the girls start with exercise but are not adherent to the exercise. So probably the type of exercise would change for them.
I'm sorry, I think I had a network issue and I got disconnected. I would just like to add on the lean PCOS, Semira, what you must have said already. Please say that in PCOS, basically it's an endocrinopathy which is affecting the reproductive system. But the lean PCOS type is less commonly seen as compared to the obese PCOS. And when they have done a study, it's a PubMed study where they have seen that even in lean PCOS, though their BMI was not high, they had altered hormonal, metabolic, and hematological profiles as compared to their healthy counterparts. So again, the treatment would, the mainstay would be weight maintenance and insulin sensitizers and all the lifestyle changes again. Was I audible, Semira?
Yes, ma'am. Yes, ma'am.
Yes, yes.
Okay, I think we're done with most of the questions. There's one question on, is Surya Namaskar beneficial for PCOS? Ma'am, would you like to take that?
Okay, I actually have a candidate who is doing her PhD study on yoga in PCOS. And when we were going through the literature or the introductory part, so why are we insisting on yoga and not a high intensity exercise? So initially the forms are like, we see that one of the symptoms of PCOS is fatigue and weakness. So instead of directly jumping onto a high intensity exercise, I think any form of low intensity exercise to begin with is good enough. And even Surya Namaskar in that sense, I don't think it's a high intensity exercise. So females can go ahead with doing Surya Namaskar. But we again have limited literature published that Surya Namaskar is beneficial. But as a whole, there are publications where yoga is beneficial in PCOS.
Absolutely, ma'am. I agree. The next question, can I take more questions? There are, I think, 2 more questions.
We have another 5-10 minutes left.
Yes. Okay. So the next question that I see is, what's the difference between PCOS and PCOD? And ma'am, I would again want to ask you, would you like to take that?
No, you take it.
Okay. So PCOD, like many people, we've heard the term of polycystic ovarian disorder, or so PCOD is and PCOS is not the same thing, if I have to say. It's definitely, if not a precursor, but a less intense thing, because PCOS not only includes the endocrinological dysfunction, but includes a lot of metabolic dysfunction, includes a lot of psychological disruption, which would not be only a part of PCOD. So it's definitely not the same thing. And apart from that, we have another question on what type of weight what type of weight maintenance can be done in lean PCOS? Okay, so I think one of the things that is much different in lean PCOS is when we're tapping into the mode of exercise and type of exercise, a lot of focus is also given on resistance training or other strength training in lean PCOS, so that there is a gain in the muscle mass, because that will help in maintaining the weight in lean PCOS. So a greater focus would definitely be on resistance training and strength training. Ma'am, would you like to add something?
No, correct, true. Again, we have no much published data that this form of exercise only will help in lean PCOS, but weight maintenance, as you said, that they may not go in for weight reduction programs also, but a good healthy weight with all the dietary habits should be beneficial.
Absolutely. So I think we're done with almost all the questions, at least that I can see.
I think it was a very good talk, Semira, and nice to share the platform with you. Hope to see you more on such platforms.
Thank you so much, ma'am. It was an absolute honor to actually have this presentation with Sancheti after I've passed out from Sancheti, and also with you, ma'am, Aarti, ma'am.
Yes.
It has been a complete privilege to be a part of this webinar on PCOS with you.
And a very big thank you to Suroshri and Sancheti Physiotherapy College for giving me an opportunity to chair this platform. Thank you very much.
On behalf of Sancheti Institute, I would like to thank the both of you to have such a wonderful and extremely informative session on PCOS and physiotherapeutic role of management. And thank you so much, Aarti ma'am. Thank you so much, Semira ma'am. And looking forward to more associations in future. And to the audience, the next Saturday session will be on incontinence. So let's meet again on next Saturday. Thank you, everybody. Have a good day.
Thank you so much.
Thank you. Thank you.